mute. My name is Nicola and I have with me Jenny, and we're both from the Australian Digital Health Agency. Now, during the webinar, we'll be going through a number of slides and key points with regards to electronic prescriptions, what you need to know and how to get prepared. And you will all receive a copy of the presentation slides in a few days after the webinar has finished. So I'd first like to acknowledge the traditional custodians of the lands we're meeting on and pay my respects to their elders, past, present and emerging. And I'd like to acknowledge and extend that respect to other Aboriginal and Torres Strait Islander people and elders from other communities who may be joining us tonight. So tonight we'll be using Slido so that you can ask any questions, and also at the end of the presentation provide us some feedback. Now, to access Slido, you simply type into an internet browser like Google, sli.do, or you can simply type in slido.com. Now, you can do this on your phone, computer, laptop, or even a tablet. And it normally, when you enter that into the search, it just comes straight up as the first in the line. Now, when you click on this, you will see a screen similar to, well, exactly what's been displayed here on your screen. And then in the enter code is, you simply type in N549 and then click on the green arrow. Now, once you're inside there are two tabs, one with a Q&A, and by selecting this, you can type in your questions, which we will go through at the end of the presentation tonight. Now, the other tab is a poll, and once again, at the end of tonight, we'll ask you to answer that as well. All right, so tonight we'll provide an overview of the roadmap for electronic prescriptions, highlight the electronic prescriptions functionality that will be available in the short term, and explain electronic prescriptions' core features and benefits, outline how prescribers may use electronic prescriptions in routine practice, and clarify what organisations require to start using electronic prescriptions. So what is the agency's role? The Department of Health and the agency have collaborated to develop a technical components of electronic prescribing, the Conformance framework and the national change and adoption activities. And as you can see, work on the electronic prescriptions commenced in 2018, and the technical team has invested significant effort in developing the technical framework. Now, the technical framework has been co-designed with key stakeholders through the agency's electronic prescribing technical working group. Participants include the medical software industry, health professional peak bodies, consumer, and government. The technical framework details the requirements for software providers to make changes to their software products. Now, this ensures software will be aligned with the electronic prescribing legislative framework, which ensures adherence to privacy and security principles and maintains patient choice. And of course, change and adoption activities is also a significant piece of this work. And this is to ensure that prescribers, dispensers, and also consumers are aware of how electronic prescribing will work and what they need to do to be prepared. Now, you will hear more on this throughout the presentation tonight. So this is a high-level view of electronic prescription implementation timeline, outlining the Australian government's recent measures announced in response to COVID-19 and the longer-term electronic prescription solution. So what's happening right now? Well, there are immediate options available for patients to receive medicines. Special arrangements have been put in place for prescribers to provide pharmacies with a clear digital image, now via fax, email or text message, of a prescription for a patient who has had a telehealth consultation. Now, some of you may know this as image-based prescribing, the interim solution, or even prescriptions via telehealth. This arrangement that came into effect is an interim solution only and for use during the COVID-19 pandemic. And so currently, this interim solution, according to the latest Department of Health fact sheets, is only current until September 30th this year. And importantly, it is also not the same thing as electronic prescriptions. And we will not be going through the detail of the interim initiative during this webinar. But if you've got any questions related to the interim solution, please refer to the Department of Health directly, and you can also refer to the fact sheets that are available in the link that we've got on this slide. The Pharmaceutical Society of Australia have also got a great resource on their website which breaks down the interim solution for prescriptions via telehealth, and it includes specific legislation via state and territory. And I've also got a link on this slide for that as well. Now, from late May, early June, implementation of electronic prescriptions is being accelerated in response to COVID-19. So the token model will be available. Essentially, prescribers will be able to generate an electronic prescription, send that as a token, which is a unique QR code, to the patient via SMS or email. And the pharmacist will scan the QR code and download the prescription details. Now, this solution has been part of the electronic prescriptions plan for some time, but it has been accelerated. And the token electronic prescription model will be the focus of the presentation tonight. Now, finally, from late this year, the active script lift model of electronic prescribing, in addition to the token model, will be available. And Jenny will go through the differences between the token model and the active script list in a slide soon. Now, for patients, the option to receive a paper prescription will always exist, even when the electronic prescription is available for prescribers.
Thanks. So before we move on completely on to electronic prescriptions, let's just quickly compare prescriptions for telehealth with electronic prescriptions, just to make sure everybody's clear on the differences. The first point I want to address is the presentation. So prescriptions for telehealth are technically still your regular paper script. So it's either sent off via fax, or an image can be taken and converted to a PDF or a photo file that is then emailed or sent to pharmacy via an SMS, for example. Now, with electronic prescriptions, they are completely electronic, so there is no paperwork that needs to be printed in order to access them. In terms of the signature, prescriptions for telehealth must be signed. So before faxing it, it will need to be signed, or if it was a digital PDF, you can still sign the PDF document with a digital signature. But with electronic prescriptions, there is no need for a signature. The script is actually authorized through the prescribing software that you use. Now, how do these get sent? So prescriptions for telehealth go directly to the patient's pharmacy. The patient doesn't actually get a copy to avoid getting sort of duplicate dispensings. On the other hand, with electronic prescriptions, it is the patient that receives the prescription, and they can then decide when and where they want to have it filled. So there's certainly a lot more flexibility there for the patient. In terms of storage, so with scripts for telehealth, prescribers are required to keep the original paper prescription on file at the clinic if they chose not to post it to the pharmacy. Or even if it was saved as a PDF, you still have to keep a record of that on the premises. If we look at electronic prescriptions as an alternative, it is only the patient who keeps the details of their prescription. The prescriber and the pharmacist will only have their prescribing or dispensing records to maintain within their software, so they won't actually need to keep any paperwork or photos or PDFs recorded anywhere. With repeats, the difference is that the patient gets to keep their repeat with an electronic script, while with prescriptions for telehealth, those actually have to be kept at the pharmacy. So the patient doesn't get a choice of going to a different location for their repeat, which may be less convenient for them. There are also some differences in legislation amongst different states and territories, but most of them don't actually support the use of prescriptions for telehealth for drugs of dependence and S8s, while the idea with electronic prescriptions is that they will be able to be used in all cases once legislation is finalized. And just as a last point, we've just mentioned for now, prescriptions for telehealth are in effect until September 30, whereas electronic prescriptions will be an ongoing solution. So just a quick recap, electronic prescriptions are basically an alternative prescription option. We know that previously only paper scripts that have been signed by a prescriber were considered the legal form, but obviously now work is underway to recognise electronic prescriptions as a legal option across Australia as well. Electronic prescriptions will not be mandatory. That means patients can still choose to receive a paper prescription if they want to. They just can't have both for the same medicine at the same time. It has to be one or the other. In terms of participants, obviously we have prescribers and dispensers involved. We have software providers that are sort of tying everyone together in terms of providing the software that is used in the process. And then most importantly, of course, we have the consumers. So they are the ones who decide whether or not to have their new prescription in an electronic format. There are just a couple of things to note. So the consumer must have an IHI or an individual healthcare identifier to participate. So they will automatically have that if they have a Medicare or a DVA card, but if they don't have an IHI, they will have to opt for a paper script. Now, existing paper prescriptions cannot be converted into an electronic one. So only new scripts can be issued in this electronic manner.
So this table provides a list of conformance softwares, and it's also available on the public domain. Now, we will be maintaining this list, and as soon as newly conformance software becomes available, this reference will be updated. Now, there is an attached link to the Australian Digital Health Agency's website with this information, so please refer to this list in the first instance. Now, it's worth noting that just because a software provider is listed on the web page as conformant doesn't necessarily mean that all of their customers with that software product will be enabled for electronic prescriptions and have started using the functionality. And users must ensure that they have followed the directions from the software providers. And it's also vital to ensure both prescribers and dispensers continue to remain up to date and in close communication with their clinical peaks so that they are aware of what they need to do to ensure readiness for electronic prescriptions. So electronic prescriptions will have a staged rollout across Australia due to individual state and territories' level of readiness. Now, as we touched on before, Commonwealth legislation has been changed to recognise an electronic prescription as an alternative legal form by which medicines can be supplied. Now, further to this, states and territories are working on finalising details for their own legislation to enable this. And as you can see in this graphic, Queensland legislation does not currently recognise electronic prescriptions for medicine supply. However, they are targeting the end of this month to have that legislation pass through Parliament. So please stay tuned for updates coming soon. And look, although Queensland legislation is not quite ready, it's still really important for practices to be prepared for the change and be ready when the legislation has passed. Now, most other states in Australia do have legislation that allows for electronic prescriptions. So this means that the system is currently being validated in communities of interest. And this is where electronic prescriptions are currently being issued and dispensed. Now, as I said, there are a number of communities of interest that are being established, and this is actually to ensure a smooth rollout of the electronic prescriptions across the country. Now, electronic prescriptions are currently being progressively rolled out, as I said, through these communities of interest, and they are to ensure that the technical or workflow issues can be addressed on a small scale. And the broader rollout will take place as more software providers progress through their conformance testing. Now, a communities of interest is at least one general practice and one community pharmacy in a nearby location that are electronic prescription enabled. And you would have all heard in Anglesea in Victoria, there was the very first communities of interest. However, there have been many since that are rolling out electronic prescriptions on a small scale. Now, initially, this validating the token model, and we expect the active script list model to be included in the communities of interest from August this year. And progressive deployment of electronic prescription in steady and managed approach is expected by September this year. So when Queensland legislation is aligned with the Commonwealth, we expect the communities of interest to start here as well.
So now we'll look at the two different models for electronic prescriptions. First up, we have the token model, which is the model that's being rolled out through communities of interest at the moment. And the way it works is fairly simple. So a prescriber issues a prescription and they generate a unique QR code for each medicine. And this is what we refer to as the token. They can then send it directly to the patient's mobile device via SMS or email, for example. Now, the token itself is not a legal document. The legal entity is actually the electronic information that resides in the prescription delivery service. And when that token is scanned by the pharmacy, they can access or retrieve script details from the prescription delivery service in their dispensing system. The second option will be the active script list, which is exactly that. So it's a list of all active prescriptions for an individual patient. When the patient comes into the pharmacy, they will present some identification and give the pharmacist consent to access their active script list to view the script for dispensing. The pharmacist can then retrieve all the required prescription details from that patient's active script list. So this model will primarily overcome the issue of lost tokens, and it is going to be also very suitable for those patients who take multiple medicines so that they don't need to manage numerous tokens. So basically, the active script list is the more complete solution, but it is also a bit more complex to develop. So we are expecting it to be rolled out towards the end of this year. So now I will just take you through a case study. So our patient here is a 4-year-old Julian. He is running a fever and he has a sore throat. His parents have brought him into the clinic for a consultation with the GP. The doctor makes a clinical assessment and asks the parents if they would like to receive a prescription for Julian's antibiotic as an electronic script. The parents agree, and so the doctor sends a token for Julian's script to his mum's phone via SMS. So on the way out, they drop by the pharmacy. Julian's mum presents her mobile phone with the token QR code to the scripts counter at the pharmacy. The token is scanned and pharmacy staff can confirm Julian's details, his medical history, his allergies, and the pharmacist can then dispense the antibiotic for him. So as you can see, electronic prescriptions can be used by everybody, including children. So there are absolutely no issues with family members receiving tokens or collecting medicines on behalf of a relative. So this really is just a good example of how we see this model used in the future post-COVID-19 when patients start to actually see their doctor at the clinic more regularly. So looking back at our token model and the steps we saw happen in the case study. So firstly, the doctor used her software to generate an electronic prescription. She then sent the token for it straight away to the patient or, in our example, Julian's mum. They can confirm that they have received the token before they leave the consult room. Then they can either present with it at the pharmacy or they can share it with their preferred pharmacy electronically. So usually a pharmacy will have a dedicated email, mobile phone number, or an app if they've got one that will allow the patient to share their token with the pharmacy.
All right, so here is an electronic prescription workflow example to help you better understand what the process might look like. And now this is just one example, and this one focuses on the token model. Now, With doctors, this is where you will ask your patient, would you prefer a paper or an electronic prescription? And as you can see in this example, you can select from a few options. The highlighted one shows in this example that the patient has chosen the electronic prescription option and for this to be delivered to his mobile phone. Now, this slide shows you a sample image of how electronic prescriptions QR code may present on a patient's phone. Now, this is when it's sent by the doctor via the token model. Now, in the first image, we can see the message contains in a list of the patient's SMS messages. The second image shows the notification that an electronic prescription has been received by the patient and it has an attached token in the form of a QR code. Now, in the third image, we note some specifics of the actual prescription received. Now, this includes the patient's initials, the medicine name and strength, and you can see it's amoxicillin 500 milligrams. It's got the QR code and also the QR code specifics. Now, this slide shows another of the electronic prescription options. This is email, and it does show you what it may look like for the patient. Now, on the left of the screen, in the email method, it shows has a link to the QR code. And on the right-hand side is a printed token method displayed as a PDF. So then how does it look at the pharmacy end? Now, look, this is just a sample image but there are different conformance softwares and they'll have their own individual look, feel and functionality. So this is really just an example for you to have to see what it might look like. So at the pharmacy staff member will scan the token's QR code to retrieve the patient's electronic prescription from the prescription delivery service. Now, depending on the circumstances, this step could be completed by scanning the QR code directly from the patient's phone in store, or alternatively by scanning the QR code provided by the patient via the pharmacy email or SMS system. Then the pharmacy can proceed to dispense the electronic prescription through their Conformance software and supply the medication as normal to their patient. So here we've got a number of scenarios which may eventuate in your practices. Now, these scenarios are based around the most common themes of inquiries and requests we've received through over the last month or so. So the first question is, if the patient is unable to receive an electronic prescription token, for example, they don't have a smartphone, what would they do?
Yeah, so that is a very common scenario. You could be treating an elderly patient, or like we mentioned earlier, it could even be a child. So in these cases, the patient can provide the prescriber with their carer's contact details to receive the token on their behalf. Or they can still choose to receive a paper prescription if they prefer. They definitely have options. And this is definitely a very good time to start updating your patients and their carers' contact details to have the most up-to-date records and make that process more efficient during the consultation.
Great. So in the second scenario, a token is not received by the patient. So the patient may have given incorrect contact details, or they even may have out-of-date information, and that results in the token being sent to the wrong number or the wrong email address.
Definitely getting your staff members to update patient details before they see the doctor will help prevent tokens being sent to the wrong number. And we do encourage prescribers to confirm the receipt of the token before the end of the consultation with a patient. However, if an error has occurred, prescribers will still have the ability to cancel the prescription in their software and generate a new one with a new token.
All right, and in the third scenario, what happens when a patient has repeats on the script?
Yes, so with repeats, a new token for the next repeat will be generated by the dispensing pharmacy. And again, it will be sent to the patient's device by their preferred method. Once the original token is dispensed, it does become invalid. So when the patient is ready to have their repeat filled, they will need to show the pharmacy the new token to have that dispensed. We also have some examples of what will be displayed to the patient in those situations we just touched on then. So there might be instances where a script has expired, or if it's been already dispensed, or like I mentioned earlier, if a script was cancelled by the prescriber. So in these cases, the QR code doesn't come up. The patient's phone or their device that they're using will just display the relevant message corresponding to what's happened with their token. Now, do keep in mind, obviously, that the appearance of these may differ slightly in real life depending on the prescription delivery service that's being used as well. So we do have a couple of more scenarios. Number 4, Nikki, can you talk us through what happens if a patient deletes a token?
Yeah, absolutely. So, look, we really know how easy it could be for a patient to delete the SMS. And the first person to get the call will normally be your receptionist. So, the receptionist could either send a note linking the patient's details of the request to the doctor to resend the token. Now, they do need to make sure to note the number that it should be resent to.
Yep. And are there any safeguards in place to prevent patients using their token at multiple pharmacies?
Yeah, so like we've mentioned before, once a token has been scanned and dispensed by the pharmacy, the token then becomes invalid and it cannot be reused.
Now, will software cater to different legislation requirements of individual states and territories?
Yeah, so software providers are working diligently on all the specifics. However, practitioners are still obliged to ensure that they are compliant also with the legislation. And it's really important to keep up to date with legislation amendments by each state and territory, and also to keep in touch with your software provider to keep up to date with what they're doing as well. So, a couple more. So, Jenny, do electronic prescriptions still work for prescribers if ERX or MediSecure is not installed?
So having ERX or MediSecure is actually a key requirement for electronic prescriptions. They act as those prescription delivery services I mentioned earlier that allow the pharmacist to retrieve the details of a prescription once that QR token is scanned. So you definitely need to have one or the other in place to generate electronic prescriptions.
And what about electronic prescriptions for S8 medications?
Yes, so electronic prescriptions will be able to accommodate the supply of Schedule 8 medicines. Legislation does differ amongst different states in terms of the requirements, and certainly we have to see how that will work in Queensland once the legislation is passed. But certainly looking at other states and the software features available there, we do know that generally S8s will be a part of electronic prescriptions.
And is that the same for electronic prescriptions for authority scripts?
Yeah, so authority prescriptions can also be generated and transmitted electronically. It is best to contact individual software providers with any specific questions surrounding that, but there are certainly mechanisms in place like the online PBS authority system through HPOS that do allow prescribers to get all the information they need before generating an authority script, and they can definitely issue it as an electronic one.
Thanks.
So the last question we'll address for now is regarding the costs of SMS messages that go out to patients when a token is sent. So at the moment and until the 30th of September, the Department of Health is going to be funding the costs associated with sending the messages across. If it is something you want more information on, would recommend contacting your own software provider to check with them what the costs are specifically and how these will be managed beyond September. Also, do keep in mind that sending tokens across as an email is a free option, but patients should always be asked what their preference is and if they're happy to receive it in that form.
All right, so this slide shows our readiness checklist, which is included in the fact sheets and is also available on our website. And as we said previously, the core requirement is that you be registered and connected to the HO service. And look, a really simple check to see if you're connected to the HO service is if you can validate the patient's IHI. If you can do that, you will know that you are connected and that it is working. Now, I will also note that some practices may have the prescription delivery service installed, so ERX or MediSecure, but not necessarily have them turned on or active. So it's really important to ensure that all these functions are set up and working before you can begin using electronic prescriptions. And of course, the last step, you will need to upgrade your clinical software, and that's to enable the electronic prescription functionality, and that will be there once it's available. Now, this is a progressive rollout, as we've said before, so you will need to stay in touch with your software providers to find out when this might be available for your software. And please keep in contact with your local pharmacies about yours and their readiness. And stay up to date with legislation amendments for your relevant state and territories. And of course, keep an eye on our website for more information and updates as they come through. Now on this screen, we've got some useful resources that are currently available, and this will help you ensure that you're well informed about electronic prescriptions. And there is a link to the agency's webpage, which details information for both prescribers and dispensers, and it includes frequently asked questions and the details of upcoming webinars, as well as some other general information on the electronic prescriptions topic. Now there are e-learning modules coming in the last week of June, which will be really worthwhile you having a look at. And we have also included links to the Department of Health's website and relevant fact sheets, along with links to the prescription delivery service software sites. Now, we have been doing a number of webinars for both prescribers and dispensers. And just in the month of April, we did present to more than over 2,000 clinicians just on electronic prescriptions. And we will be continuing these sessions throughout this month. Now, on this slide, we have got some upcoming webinars on electronic prescriptions. And we also jointly previously ran some webinars with some software providers. And one of them was ZMed. And those links will be available on their website. And the other one was best practice. Now, they will make those available for their customers. So if you're one of their customers, just get in contact with them and they should be able to provide that for you. Now, if you are wanting to know more about electronic prescription and what it means, I would definitely recommend that you attend the electronic prescription updates through RACGP. Now, they have an on-demand webinar available through June, and this addresses multiple topics, and those include real-time prescription monitoring, electronic prescriptions, and active ingredient prescribing. All right, so we've reached the end of the webinar. I'm not sure if there's any questions, but we can go through some of those questions.
Yep.
If you have not done that yet, we've got this up on our screen, so feel free to type in and ask those questions away.
Thanks, Nikki. We do have a couple of questions. So I can see David's popped a few in the chat on the side, so we might cover those first before we do the Slido ones. So the first question there is, has ePrescribing been legislated in Queensland and available for rollout? So we did briefly touch on this earlier and said that legislation in Queensland has not passed yet. We are expecting that to occur this month. So stay tuned, I suppose, in that area. So once the legislation does pass, ePrescriptions will go through that communities of interest process in Queensland, and we'll sort of go from there. The second question here is email or text secure? Can it be intercepted? So it is a bit of a tricky question. Emails and texts may not be sort of as secure as we'd want them to be, and in terms of being intercepted, you can send it to the wrong address, you can send it to the wrong number, and potentially that token can be sent to the wrong person. Now, there are safeguards in place to protect patients' information. So what you will see on the token screen is very limited personal information. So all the patient will see is the name of their drug, the quantity, repeats. It won't have their full name. It will just have the initials displayed. It won't have their address or date of birth or any sort of identifying information. So that makes that information sort of safe enough to transmit over email and text message. The other thing is that the information within that token is actually encrypted, and the software providers who are developing these electronic prescription capabilities will ensure that access to the full sort of prescription information is strictly authorized. And the way they do that is by following those conformance requirements and the technical framework that Nikki mentioned earlier in the presentation. So any software that wants to have access to the token will need to be on that conformance register that we showed you a couple of slides earlier. One more question I can see on the chat. Can patient get a subsequent repeat at a different pharmacy? Did you want to answer that one, Nikki?
Yeah, sure. Yes, that's a great question. So once I guess if we like to think about the electronic prescriptions as just as how it is now, the only difference is that it's going to be in an electronic form. So it doesn't matter where you take your prescription to. So if you've got a repeat token on your phone, you've been to pharmacy A to get that first repeat dispensed, and they've given you another token. You can then take that token to pharmacy B to then have it dispensed at that pharmacy. So it's the pharmacies that are enabled and able to dispense, they would be able to do the electronic token repeat. But they wouldn't be, if they're not ready, that pharmacy is not enabled for electronic prescriptions, they wouldn't be able to dispense that patient would have to go back to a pharmacy that is electronic prescription enabled.
Yep, absolutely. A couple of other questions in Slido I can see. Thanks, guys, for posting them there. The first one is the paper token printed on script paper? And no, it doesn't have to be printed on script paper. It is just printed on a normal A4 white piece of paper. Another question regarding repeats. Does the patient contact the pharmacy to reissue the repeat, or does the pharmacy generate the token when the previous script runs low? Do you want to talk about the repeats a bit, Nikki?
Yeah, sure, Jenny. So basically regarding repeats, so the question is, does the patient contact the pharmacy to reissue the repeat? So when the prescription is dispensed, the normal process is to give the patient their repeat when they take their medications. So what they will do is they will get the token reissued to them. So if they had the token via email, that will be reissued to them via email, and if it's an SMS, it will likewise go via SMS. So it actually is when they dispense a medication, just like current practices now. So they currently get the repeat when they get their prescription medication dispensed. So that will be the same.
Yep, I agree. I think that's mostly it for questions for now. Does anybody else want anything they want clarified? Please pop that in Slido, or if you can't get onto Slido, you can put it in the chat if you like, but we do prefer Slido. Give everyone a couple more minutes. But if you don't have any more questions to ask, do switch over to that polls tab up the top. And if you can fill out the evaluation questionnaire for us, that would be greatly appreciated as well. Oh, I have one more question. Do pharmacies need special scanners? That is actually a question that's been asked quite a bit. And they do need scanners that are 2D scanners. So they need to have the ability to scan that square QR code. If a pharmacy doesn't have a scanner that can do that, on that patient screen where the code appears, there will also be a numerical number that identifies that prescription. So the pharmacy will be able to type that number in their dispensing system as well to access the script. So there are other options for them available if they don't have a scanner that can scan it, or if it broke. Yeah, there's some other options available for them there. One more question. Is there ability to do Reg 24 scripts with electronic prescriptions? And the answer is yes. Yep, absolutely. You can do Reg 24. The way it's sort of issued may differ slightly depending on the software that you use, but it's certainly going to be a feature that is available to make electronic prescriptions as easy as possible to use. Just give everyone a couple more minutes to see if they want to ask anything else. But I can see that some of you have filled out the questionnaire for us as well. So thank you very much for doing that. Otherwise, if there are no more questions, maybe we can call it an early night. What do you think, Nikki?
Yeah, I think so too. Look, thank you all very much for tonight. I hope you certainly got something out of it, and thank you for the questions. Yes, but I think we will call that a night. Thank you all very much for coming tonight.
Thanks for listening, everyone. Have a good night. Oh, we actually have one last minute question.
Go for it.
Might just answer that one. What about post away authorities? That is actually a very good and tricky one also. If it is a post away authority type prescriptions, I believe a workaround for that may not have been sort of developed yet, certainly working towards that. But for the time being, if it is a script that needs to be posted away, you will need to use a standard paper prescription. And that's it.
All right. Thanks again.
Might officially ended there.
All right. Thanks, everyone.
Thanks. Good night.
Bye.